The results of the review by the senior physicians and the critical incident reviews indicate that the medical assessments that were completed on both of these gentlemen did not identify any deficiencies. Saying that, because we take the safety of patients very seriously, we do have some recommendations from the critical incident reviews that indicate that we need to be enhancing our patient discharge processes. You know that as a result of the critical incident revolving around Mrs. Brennan, that we enhanced our safe patient discharge guidelines. We have reviewed those guidelines yet again, and we have now, will be piloting the introduction of a regional discharge guideline checklist. This checklist will be used to ensure that the safe patient discharge guidelines have been followed. Once there is assessment made that a patient is vulnerable and that we need to go through these guidelines. As well, we have had discussions with our transportation people, and we have had discussions with the taxi companies in Winnipeg, and we have put in place a safe patient transportation guideline that we will be starting to implement at the beginning of March. I want to emphasize that we have had a strong working relationship, a collaborative relationship with the taxi industry in the city of Winnipeg. Both the Regional Health Authority and the taxi cab industry are supportive of these guidelines that we are putting in place. They are yet to be trialed, and we will make adjustments to them as we go along. So if you have an underlying condition that could predispose you to sudden death, you can't predict when that is going to happen. If you take a look at the safe patient guidelines, they are a multi-page document. The checklist is meant to be a one-page that says, have you talked to the patient about, do they have their keys? Is there somebody at home? Do they wish that person to be contacted? It is a checklist. You have the safe discharge policy. What we're looking for now is to ensure that there is improved documentation.
That people follow it.
That there is a reminder that you have asked the patient these questions and you have had discussion with the patient on these particular aspects.
There will be nothing new on the checklist that isn't on the policy. The difference will be is we didn't have a consistent regional checklist to accompany the policy before as a quick reminder of the things that staff needed to be both ensuring that they were discussing with people, but also that they were documenting them clearly. And so the checklist will reinforce those things already in the policy. What we have found in the course of the review, that the discussions that we expect to take place did take place with the patients, but where there were some inconsistencies is whether all of those discussions were actually in fact documented as clearly in the patient record as we would like them to be. So